Welcome to the Philly Doctors. I'm your host, Dr. Rubina, and as you can see, the doctors are in. Joining us again is Dr. Zach, the owner of Breetown Chiropractic. Thanks so much for joining us again, Dr. Zach.
Thanks for having me.
And of course, Dr. Natay Guyton, the author of Transformational Innovation. Thank you so much for joining us.
Thanks for having me.
And Dr. Anita Gupta. Dr. Gupta, please tell our viewers a little bit about yourself.
Thank you so much, Rubina, for having me here tonight. I am an anesthesiologist, as you know. I'm also a pharmacist, and I'm here to talk to you about pain.
Absolutely. Let's get started. So, as we know, the number of steps we want to take each day is 10,000. So by a show of hands, how many of us think we actually do that? You know, I think maybe some days are better than others, but I'm going to raise my hand.
Okay,
Yeah.
thanks.
Yeah, you think so too?
Probably don't reach that every day.
No.
Some days.
And a lot of Americans don't reach that number every day. The average American takes less than 6,000 steps per day. And this is a risk factor for sedentary lifestyle.
Right.
So we want to motivate our Philadelphia community to move more. So Dr. Guyton, do you have a favorite place that you like to run in Philadelphia?
I love to run around Kelly Drive,
Okay.
especially when it's great weather.
Yes.
But I need to set my pedometer because I don't get the 10,000 steps a day.
Right.
So,
So you think it's a good tool, the pedometer?
oh yeah.
To keep
Yeah,
track
because
of what's going on.
you know, so much going on. Right?
Yes.
And so I don't usually keep track. So yeah, I think I'm gonna get one of those to keep track.
Okay. Dr. Zach, where do you like to run?
I also like to run around Kelly Drive, specifically behind the Art Museum is a really great area. I like to go at night just because that's when I have my free time, and it's really a beautiful scene. The Art Museum is lit up, the boathouses are lit up, you can see the skyline, and it's a little cooler in the summertime. So there's advantages to running at night as well as advantages to running in the daytime. When we exercise in the sun, we actually convert cholesterol to vitamin D. So if you can work out in the sun, it's great,
That's a good
but
point.
sometimes it's just a little hot, and I like to go at night when it's a little cooler.
Right, and we want to be careful, stay hydrated, right?
Absolutely.
What about you, Dr. Gupta?
So I get my 10,000 steps for sure. And in fact, much of the steps that I get are actually in the hospital. I work in Center City at Hahnemann University Hospital as an anesthesiologist, constantly on the go. I probably get a good 30,000 just at work.
Wow.
But when I do get time, one of the greatest things that I do is actually walk around Center City, around City Hall. You can have a wonderful walk around that. It's probably about a mile back into, and it's very scenic. You see wonderful people on the way, and a breath of fresh air too.
All of the great landmarks in
Absolutely,
Philadelphia.
absolutely.
And you bring up a good point because going over the Ben Franklin Bridge, we were talking about this earlier, 3 miles, really easy to get your numbers in. The Kelly Drive Loop is about 8 miles.
Right.
But what we need to be careful of is wear and tear. So healthy behaviors, we still have to be cautious. And so what we're going to talk about today is extremity complaints. So what's happening to your knees, your ankles, what kind of shoes are you wearing? Do they have an effect on your health? Really important things to talk about. So Dr. Zach, you see a lot of heel pain.
Absolutely.
A lot of plantar fasciitis
Yes,
in your
a
office.
ton.
Can you tell us exactly what plantar fasciitis is?
Okay, so plantar fasciitis, like you said, is one of the most common injuries I see, especially with people who are running and active. What it is an injury to the plantar fascia. But what is the plantar fascia?
Where is the plantar fascia?
Where is the plantar fascia? So in our feet, we need to wiggle our toes. We need to feel stuff when we step on something. So there's muscles, nerves, blood vessels that are on the bottom of our foot. And what the plantar fascia is just a band on the bottom of our foot that protects these tissues.
It's like an elastic band, almost.
Yeah, exactly, and it provides some support too. So what can happen is this tissue can get irritated, and there's 2 main causes of the irritation to the plantar fascia. So our foot has a nice arch, and what happens is the fascia connects from our heel all the way to the front of our toes.
Yeah.
So what happens is when we lose our arch, when we get a flat foot, the fascia can be stretched, kind of like this, and that's one way it can irritate.
Okay.
And also, when we work out with improper footwear or
Right.
shoes that are too small, it can become compressed. So what happens is you start to feel some heel pain.
Right.
It can be as slight as feel like somebody's poking you in the heel. And I've heard people come in and tell me it feels like they're stepping on a railroad spike when they get out of bed in the morning. So
It's really painful.
yeah,
It can be really painful.
it is really painful.
But also overuse syndrome. So if we're doing something too much and we're not practicing good habits, right?
Yeah.
So, okay, I have something to show everybody. What do we think this is, doctors? Any guesses? The secret weapon? The MyNEWPhilly doctors
Maybe
secret
something
weapon?
for my back.
Yeah, it probably, yeah, it probably could be, right? Any guesses? Anyone? Anyone? Well, what's become really popular is instrument-assisted soft tissue therapy. And so I thought it'd be really a cool idea if I volunteered Dr. Guyton to have Dr. Zach show us exactly how to do this. So this is what we're gonna do now. We're gonna head over and we're gonna show you at home exactly how this can help with foot complaints and extremity complaints.
All right.
Okay, wait, on my foot?
Yeah.
On your foot.
Okay.
You're gonna love it.
Because I wear the heel, so I'll
So you
probably
need it.
You,
Yeah,
yeah,
absolutely.
you need it for
I do.
sure.
Yeah.
All right, guys, let's go
All right, let's do it.
do this demo. Okay, Dr. Nate, let's get comfortable.
All right.
This is exciting. I love demos like this because you at home get to see exactly what the treatment looks like. Because I think sometimes people get a little bit of anxiety about wanting to try new things, right?
Definitely.
Okay, so what exactly is happening? Are you using some type of special cream?
Yes, I
Okay.
do have to put cream on the area before I treat it, just to make sure that we're affecting the fascia and not the skin. We don't
Okay.
want to cause any skin irritation to Dr. Guyton.
Yes, no skin irritation. And is it kind of like the consistency of coconut oil?
Yeah, this one is actually beeswax, vitamin E, and canola oil, so it's actually going to be good for your skin too. Yeah.
Okay, so you're using the instrument in which type of motion? It's a sliding motion, yes?
It's kind of like a scraping motion.
Okay.
And what I'm doing is I'm scraping fascia. And what fascia is this tissue that covers our whole body, our joints, our muscles, our bones, our organs, and it can get kind of tight, just like in plantar fasciitis. So our bodies are always changing. Like when we exercise, our bodies are getting bigger. When we spend a lot of time on the couch, we might lose some of that muscle mass, gain a little weight. So when our feet are in uncomfortable positions or there's something going on with a foot, the way that the fascia is laid down is going to be improper. So what we want to do is we want to scrape that fascia and just promote normal healing and restore normal biomechanical movement.
Okay,
All right.
I'm ready. Are you
You
ready?
ready to do it?
ready.
All
You're
right.
ready. You're gonna tell us what it feels like?
Yeah, first thing you need to do is just warm up the area so we're not going in cold, so just kind of flex your foot back and forth.
And
Yeah,
so
we're
this
gonna
is
get
to
a little
bring blood flow to the area?
bit- Yeah, so we can
So-
warm up the muscles,
Yeah,
yeah.
stretching, always good.
Good. All right, you're really gonna like this part. So I just gotta get a
Have
little.
you had this done before?
No.
No, never. Okay, it's your first time doing it.
Okay. So what I'm gonna do is just put a little bit right here.
And that's the starting point of the fascia, yes?
Yes.
So it goes
And
right along the arch.
from the ball of the foot
Yep.
all the way down to the heel. And
Okay.
most people experience the pain in the heel,
Yes.
but some people can experience it in the midfoot as well. But the most common area is in the heel.
How you doing?
Good.
Is it good? What does it feel like?
Good. Feels like, you're getting a pedicure and
Okay.
they scrape the bottom. Yeah, it feels a little bit like that.
So it's
but
not
a little bit more intense.
Painful.
Not
Okay, a
painful,
little bit more
not
intensity.
painful.
So you could totally handle it.
Yeah,
It's
like
doable.
Like a Dr. Zach foot massage.
Yes. Yeah. And is there different parts of the instrument? Like I noticed, did you just switch it out?
Yeah, when you want to get a broader contact, you can use the top. And if
Okay.
you want to get a little bit more specific, maybe in the arch of the foot, you can kind of just scrape like this. And you can, yeah, we got a good one right there.
Good point. Yeah, a
all the way
little
up my
tightness.
leg
Yeah.
Okay, so
And so what's happening to the fascia? I know that sometimes when I do this on my patients, they experience a little bit of redness. So what would that be?
So we're breaking up the adhesions
Mm-hmm.
and scar tissue, but also blood is being drawn to the area.
Okay. And when we
and-
bring blood flow to the area, we're facilitating healing.
Exactly. So somebody who has chronic plantar fasciitis,
Yeah.
it might just be something that their body is growing accustomed to. So we might need to restart the healing process. In an acute injury, when something happens, your body is going to naturally work on healing that injury. But when stuff becomes chronic or it's
Right.
not taken care of, we get used to it,
Yes.
and our body is not going to focus on that. So this is drawing attention to the problem area as well as clearing up a lot of that fascia that's become problematic.
Right. Now, can I use that at home? Can I get one of those and use it at home?
So it's probably not a safe idea, I know. You definitely want to do this treatment with a regulated healthcare professional. Go to your local chiropractor, find Dr. Zach, find me. But you don't want to take this tool home and work on all of your muscles because it is a focused response, right? We're looking for a specific change to happen in that area. So too much could hurt the body, but too little might also not be so productive in the treatment, right?
Absolutely.
So you always want to be safe, right? Safe
So
with the treatment.
with my busy schedule, how much or how often should I come? to get this done?
It depends on how far along your condition is. Some people, it might take a few treatments. Some people, if we catch it early and it's not that severe yet, we could clear it up in maybe 1 or 2 treatments. So it's very, very efficient. One of the reasons that I love this tool and my patients love this tool because it just saves them so much time and money, and they don't have to come in for so many treatments.
And how would they know? Like my grandmother, right? She's
Yeah.
like, oh, I have this foot pain, you know. How would they know to call you guys?
That's such a good question, and you need to get evaluated. So heel pain can be one of many things, actually. The most common thing that presents in an office setting will be plantar fasciitis, but you really need to have a healthcare practitioner do a differential diagnosis, meaning that you go in, let's say heel pain could be 10 things. The practitioner is going to be able to cross things off this list and really focus on what your cause is, right? A specific diagnosis, that's what you need in order to have this treatment. And like you were saying, it's easy with a busy schedule because it's only 3 to 5 minutes, yeah?
Yeah, absolutely.
Okay.
Very quick
And you
efficient.
can use this on other areas of the body. So
Yes.
one area in particular for the runners is that IT band.
Yes.
So side of the leg, it's also like that elastic band tissue that Dr. Zach was saying. That can also become chronically tight. And I know you say that that part of the treatment's a little bit more painful.
Yeah, the IT band treatment is definitely something that the patients feel. It is very sensitive area, but it's also very effective too. So you're gonna feel it, but you're gonna feel better when it's done.
Yeah, absolutely, and that is the key.
And what about my kids? So I had 2 children.
Yeah.
And we know kids are playing sports early.
Yeah.
They're out there on the field alone, and
Yes.
they're complaining
Yes.
of injuries.
Yes.
Right. So how early should someone, get an evaluation for their children?
As soon as they start playing sports, as soon as they start feeling pain, you don't want it to become a chronic condition.
Right.
This might not be the best option for every kid. Maybe teenagers you could use this on, but that doesn't mean that you don't want to bring them in. As soon as they're feeling pain and you're seeing dysfunction, it's important to catch it right away.
Interesting. Thank you. This is very informative. You're going to put your shoes back on, and speaking of shoes, we're actually going to check out more shoes because we want to make sure that what's on your feet is actually protecting you. So have you done a shoe check? Let's all do one together so that we can keep our feet happy feet. Let's go.
All right.
Alrighty, so now it's time for some shoe talk. I see you've set up this nice display for us. So it's really important to remember that our feet are our foundation, right? And the body works like a chain. So if we have a problem with our foot, what can happen is that can translate up to your knee, to your hip, to your low back, mid back, shoulders, and even the position of your head and your neck, right? And so we don't want to change posture. You don't want your body to work harder. So let's talk about shoes. So of course, the running shoe, we all have our go-to pair for running shoes. But have we really ever looked inside? Do you look at the support? And so I wanted to start first by, addressing the toe box. And these are some of the areas of the shoe that you really want to think about when you're shoe shopping. So anyone have the issue where the toe box is always too tight?
Right.
Right?
Absolutely.
And did you ever buy the shoes and wear them anyway?
Absolutely.
course.
We do it all the time. We do it all
Right.
the time.
And long term, this can have really bad complications, bunions, corns. So you're really squeezing the toes, right? And so then over time, this is going to develop to pain. So what is your tip, Dr. Gupta, when it comes to thinking about having enough room? Do you have a rule or an idea that you might want to share with us?
Always buy the last pair of shoes. That's what I end up doing. The stores are out of shoes and we end up buying that last pair like so many other people. But what I can tell you is that when you buy a shoe, think about the cushion for sure. Make sure there is arch support there because as you had said, anyone that has any problem with their shoes can end up with lower back pain, hip pain, knee pain, and specifically around the toe. I mean, I myself buy the wide pair of shoes, and that is hard to come by, but if you get that, your feet will be much, much more happier.
Right. And I think we have to remember that we go in, we look at shoes, they're not really going to stretch. So as many times as we hear that, we kind of want to stay away from that idea. And let's talk a little bit about pronation and supination. So Dr. Zach, you see this in your office a lot.
Yep.
How can we explain pronation and supination?
Okay, so pronation is kind of when, I'll just use this as our model foot right here. Sometimes people's feet can kind of turn out a little bit. And one way you can look for this on yourself is actually look at the wear on your heel. And what you want to be aware of is that once your foot starts to turn out this way, what's going to happen is your leg and your knee are going to compensate for that, and they're going to rotate internally, and that can lead to your hip compensating for that and your low back compensating for that, and it can go all the way up to your head. the exact same things as what you guys are saying. It's really, really important to make sure that you're seeing somebody, a podiatrist or a chiropractor, if you start noticing heel wear that's unnormal or if you're just pronating too much.
Right. And Dr. Zach, where can we get shoes that will help support that? Is it a store or a brand you want to look for?
So when you're buying a shoe, you want to make sure that you're buying one that's big enough. People always have shoes that are too small. They want to squeeze into these shoes, but it's really important to have a shoe that's going to support your entire foot.
Yeah.
And what I like to do is I actually like to take out the sole of my foot, or sole of my shoe, sorry, and put orthotics in, custom orthotics.
Nice.
And these ones I like these ones, these are foot levelers. What they do is they take a whole 3D scan of your foot, your pelvis, your knee, and they just make sure that you have proper arch support for you. They're accustomed to you, and they're gonna help heal your body in the way that it needs to be healed. So I definitely would say big shoes and orthotics would be the best option.
Right, exactly. And sometimes with the orthotics too, you can even do the foam print. I like those too.
Yeah.
So you would do a foam print, a chiropractor, a medical doctor, podiatrist can do it for you. And then basically they build the orthotic off of the print of your foot. And it can target the area. So we were talking about the overpronation. So what's important to remember is that walking is a cycle. There's a gait cycle. And so it starts with kind of your heel hitting the ground, and then your whole foot starts to contact, but you roll in, and then you do that nice toe off. And so the overpronators are gonna roll too much. But there's also the over supinators. Supinating is a problem. So you could actually roll the other way too much, right? So you kind of wanna figure out which one you are.
Right.
But you're only really gonna figure it out is if you have someone else look at your feet, right?
Absolutely.
So get your feet evaluated, and then it's all about finding the brand that you're comfortable with. And I don't know if you guys do this, but I always try to go a half size bigger because your feet do tend to swell by the end of the day. And why does that happen, Dr.?
Well, gravity. Unfortunately, with gravity, being on your feet all day, you can get swelling. And that's, what you're referring to, and certainly can be avoided if you get a larger size shoe.
And what happens if it's becoming something chronic? Like swelling every once in a while is okay, but what happens when it turns into every day?
Well, look, anyone that has swelling in their foot, it's something you need to pay attention to. There's a lot of things that can cause swelling in the foot, anything from just having bad shoes to heart disease. It could just be standing too long, but you can't take a risk with that. If you think you have swelling that's not going away with normal measures, you need to get medical attention. But if you're on your feet a lot, make sure you have those good shoes that we talked about. Make sure you're resting enough, get arch support, make sure you have the right support system. If you're athletic, you want to make sure you're not hitting the concrete too much because that can certainly damage your foot as well.
Right.
But swelling in itself is certainly a symptom of a lot of different things, and gravity is often the cause.
And what about compression stockings? Is this something that we can utilize or we should stay away from?
Rubina, that's a great question. Compression stockings or compression garments, in fact, have become a huge industry in the athletic world. We see a lot of athletes wearing it on their elbows and knees, and in fact, there is some science behind that. Compression can actually decrease the amount of swelling around the joint, around the area where you apply it. It can actually be somewhat of a distraction technique if you're having a lot of pain there. So it can be helpful, and it also supports the joint. A lot of people that do have, say, runner's knee or foot pain or joint pain of any sort, if they wear these compression stockings, it can actually help support that area so that they don't have more pain.
Right.
And do you want to wear them while you're running or after you're running? Is there any formula?
I don't think there is, but I would like to hear what you guys think. I haven't seen that there has been, but
Have you tried them?
I have not, but I have children who are wearing them, but what I want to make a note of is get the proper evaluation.
That
to
is
your
right.
point,
That
Dr.
is right.
Guthrie. Like
That's
you
right.
said, compression could be a fad. They're
That's
colorful.
correct. That's
They're
correct.
sold at your local, sporting goods store.
Right.
But whether it's for yourself or your children, you need to get the proper evaluation.
Absolutely. Compression stockings, in an elderly individual could be a problem. It could decrease blood flow, so nothing's without risk. Certainly have to be prepared to know what those are. And
So you need a health team.
That's right.
You need a Philly doctor's team to manage you. That's what you
From birth? Because we have to, there's prevention for our children as well. You know, a lot of times we wait till we get a certain age and then we start to see a chiropractor, or we start to worry about compression, but we put these same limitations on our children in terms of sports and activity. So really, we have to do that prevention there.
Absolutely.
Yeah, and children see healthy habits. They start early, right? People are watching. People are watching. Okay, I have to talk about the heels. Dr. Nate, we've seen your shoes tonight. I must go there because I'm guilty of wearing the heels. These are actually mine. You can see I've probably worn them twice because they're painful, and I was probably sitting when I was wearing these, but high heels and foot pain, there is a risk, there is a link. And so what I like to tell my patients, and what I'll share with you, is that when you're walking in heels, it's like you're walking downhill all of the time because your feet are being pushed forward and then you have to pull your body backwards. And that's not good. It's a lot of stress on the body, and you're basically changing the way the curves of the body interact with each other and the way the muscles interact with each other. The other example I like to give is if you're doing a bicep curl in the gym, right? We all know the proper way to do it, right? Would we do them out here? Probably not. It doesn't make any sense, right? It puts your body in an awkward position. But what's your experience with heels? How do you handle it? Because you want to look good. It gives you that elongated leg, that look that we all want. What's your strategy?
Well, you know, I've been one and known to have a code in the hospital in my heels. You know, I'm doing because, you know, they're just my go-to staple. But I think my secret is knowing, you know, that I really don't go all day. So I have a driving shoe in my car, which I spend a lot of time in my car driving, and I have support and orthotics in those shoes. Now, and if I am walking a lot, which I don't get my 10,000 steps, but I will. I will now. So when I'm walking a lot, I make sure I have, of course, the corrective shoe. I'm not walking in my heels, but I am guilty of, you know, I could spend at least 5 hours in them. Now, and I try to get a size up. But you know, a girl who wears a size 10, you know, that could be a problem or two, you know. But I think it's good. This is good information. Get to the audience and know, you know, as you get older and you want to prevent some issues, you do want to go bigger in your shoe size. And it's not all about style anymore. So more about education and health.
I think it's about variety, and I think that the more you incorporate different pairs of shoes, the better. You know, the running shoes are, you know, always your go-to. And speaking of running shoes, I want to ask you about runner's knee.
Absolutely.
Because I want to give some information. We saw the instrument, soft tissue stuff, but I want to ask you about pain creams. Because there's many out there. And I want to give people an idea of what they should maybe look for and how that they can help.
Absolutely. Great question again. So runner's knee, first of all, is very, very common with athletes, people that overuse their joints, and commonly will have, you know, this kind of problem. And what it can be also due to someone that's involved in a car accident, anyone that might have malalignment, or say their joints aren't the way they should be aligned. We're all not made perfectly. What most people do is that they go to the pharmacy. And one of the most common ones that I see that you have there is Aspirin cream, and it's in fact mine, and you can see that it's empty. But I use it all the time, and it can be quite effective because it has aspirin in it, and that can actually be very, very good for pain relief. And as I said,
how so? How does the aspirin work on the body?
So aspirin is an anti-inflammatory, and it works by working on the inflammation process in the body. It is something you can take as a tablet, but when you put it on the joint, it absorbs directly into the skin, and that can actually be really helpful. And then the second one that I really love.
This one, so good.
I love Tiger Balm. I love Tiger Balm, and I tell all my patients to consider using Tiger Balm. The only problem with Tiger Balm is that it has a pretty strong scent, but it does work, and you know, it does temporize the situation. But the bottom line is these are symptom control medications. They're not going to take away the main problem. And in order to do that, you need rest, you need to compress, you need to elevate, and you really need to talk to your doctor.
Now, do I put this on, Dr. Gupta, before I run or after?
Well, you know, if you look at my empty vial, you know that I use it quite a bit. But I mean, really, it's what works best for you. Most of my patients, I'll tell them to put any type of, whether it's a tablet or a cream, whatever your regimen is for pain, to do that 30 minutes before you do it, because it gives it time to work. It gets you suited up and prepared to go do your work or run or whatever you're doing, and you know, can really help during that time. Now, like I said before, it doesn't necessarily cure the issue.
Right.
And in order to do that, you really need that rest, you need that support of the foot and knee. Certainly, without that, you won't heal properly. And if you don't heal properly, you will never get better and can cause more damage.
And I think the message that I love that you're saying is that pain management, symptom management, it's not a quick fix, you know, and I think oftentimes people just want something that works instantaneously. It's hard work, it's lifestyle change, it's using all of your options, combination therapy. I know you love to talk about that.
Absolutely.
Try many things, don't rely on one thing.
Right.
You know, another one I really love is the Biofreeze, the menthol.
Yeah.
Yes.
That's a good one too. Anyone use that? Do you use
Yeah,
that?
absolutely.
Yes.
Really cooling,
Yeah.
really distracting. It's quite easy to get. I've seen health food stores. I know that they're in both of our offices.
Yep.
Do you also like Biofreeze?
Absolutely. I mean, anything that has that cool sensation. There's many products, Biofreeze, there's Icy Hot, and there's so many others that are available that have that menthol in it.
Yes.
That really gives that cooling sensation. Patients love that sensation. But again, it's only distraction.
Yes.
Once the cream
But a
wears
healthy
gone.
distraction.
It's a healthy distraction. And for many, many people, that is first line of defense. And that often is all they use until things get out of hand,
Right.
and then they end up at the doctor knowing that you have a ruptured tendon or a much more serious problem.
Now, and I use Biofreeze when I get a massage.
Right?
Is that a good time?
Oh, wow.
That's a nice massage.
Is it relaxing?
Yes.
Oh, I never hear about that.
Is that a good time?
Well, I mean, it's just like anything else. It'll make you feel good for a little bit, and
Yeah.
if it makes you feel better, then why not? Why not?
Okay, massages with Biofreeze.
Yes.
And foot treatments
and
with...
for treatment with
And what's your other secret? Tell us about the pepper cream.
Oh, yes. So there are so many things.
There's so many things
So
here.
talk to your pharmacist. As you know, I'm a pharmacist before I became a physician. So there's a lot of drugs available over the counter that can be used for pain. And one, as we mentioned, was aspirin cream, the Tiger Balm, but there is many, many other types. And one specifically is the hot peppers.
Yes.
People that have nerve pain, for example, can buy a cream called capsaicin over the counter. No prescription needed, made from hot peppers, very, very effective. If you place it on the area where you have a nerve type of injury or nerve pain, it can really, really help. And
Is it going to be more intense than the Tiger Balm?
absolutely,
Okay.
it can
Because the
burn
Tiger
first.
Balm for me, it
Yeah.
can feel a little hot.
Yeah.
Absolutely.
I noticed
So in
it.
fact, we instruct our patients that you wash your hands after you use the cream
Okay, yeah.
because it can burn.
Don't touch your eyes.
Don't touch your eyes,
Right.
and be patient because it takes about 2 weeks for that burning sensation to go away, and then really to get the benefit from the drug.
Would you try it?
Oh, yeah. Tonight, I'm going to try.
Yes.
All right, now, is there any, I'll try anything. Is there any age restrictions? Because I'm always going back to treating the family.
Of course, of course. Now look, over-the-counter medications are FDA approved.
Right.
The most important thing with that is the smallest dose that you can use for the shortest amount of time. And if you go above that, you're running the risk of side effects. But for the general population, most of these things are safe. You can use it and talk to your pharmacist about it, or your doctor. There are prescribed forms of all these things, and you can get prescribed strengths of them, but before you go there, try the over-the-counter.
Thank you so much.
Yeah.
So much great information that we shared today. Let's do some final thoughts. Dr. Zach?
Okay. We were just talking about how we're just kind of masking the pain with the cream, and she was talking about ice, compression, and seeing a healthcare practitioner. Some things that can really help are correcting muscle imbalances in our lower extremities. Sometimes some muscles can be overworked and can cause pulling on a joint. And when you see a healthcare professional, they're able to identify which muscles are overworked and which ones are underworked. So PTs, chiros, and DOs are definitely trained very well in this field.
Absolutely. Dr. Guyton?
Yes, let's get healthy together. So I want to challenge you and myself to do 10,000 steps a day. Right?
I love that.
10,000 steps. And let me know, hit me up on Instagram at Dr. Guyton 10, and let's hold each other accountable. Let me know how it works for you.
This means you're getting an Instagram
Yeah.
account.
Yeah, that's
Definitely.
right. That's right. So I want to say that time and treatment, some of the most important things when anyone has pain, you need time to heal and you need the appropriate treatment. And certainly if you have questions, you can reach me at Doc Anita Gupta at Twitter. I'm happy to help you. And I really think that you can conquer your pain. It's just a matter of getting the right team on board.
The Philly Doctors. That's all the time we have for today. Thanks for watching My New Philly, where something is always new. And
everything is always Philly.